Welcome to HealthCast. I'm your host, Adam Patterson. We are joined today by Indra Sandal, National Lead for the VHA-Uber Health Connect initiative, and Ben Williams, Director of the Veterans Transport Program, for an interview on the recently launched Veterans Health Administration Uber Health Connect program. Launched in February 2022, the initiative allows veterans to access Uber's rideshare services to reach healthcare appointments they might otherwise have difficulty accessing, allowing them to more consistently receive medical and behavioral health services while saving VA considerable money from what would otherwise be lost appointments. The initiative is already rolled out for 10 VA hospitals, with plans to expand the program significantly in the near future. Indra, Ben, welcome to the program.
Thank you so much, Adam, for having us.
Yes, thank you.
Absolutely. It's great to have both of you. And I want to start out with a general background question for our audience. And I'm wondering, can you tell us a bit about your careers thus far and what brought you to your current role at the VHA innovation ecosystem and with the Uber Health Connect initiative?
Thank you so much, Adam, and for having us today in this. And we are very excited to talk about this initiative. But before we'll go in detail, let me give you a little bit of a background. And if I go too much into it, then apologize me. But want to tell you a little bit about what is the reason why I wanted to work for veterans, because that's always comes to the point that why this population. My dad was a veteran. He served 30 years in Indian Air Force and retired as a wing commander. So I grew up in a family which had a culture of gratitude and respect, and hope like one day when I was growing up that I will also get the chance to serve veterans like my dad. He's not anymore, but for my higher education, I have to come to US. And I worked almost 15 years, starting from my PhD days in genetic research, traveled 12 countries and 25 states in US to present my research work, and had a privilege to lead the various teams in Nebraska, Virginia Tech, Utah, Montana, Chapel Hill, a lot of other places. But the moment I waited since I was a kid came in 2014 when I joined Memphis, VA. After becoming a US citizen. I'm very sure audience know that to work in the VA hospital, you have to be a US citizen, and I gave up my Indian citizenship. And in 2013, I became a US citizen and got the chance to come to the VA, which was a dream came true. And at that time, I also joined the MBA in Northwestern University in Chicago. Since then, because now I was in the VA in my dream job, I always wanted to rally the employees so that they can reimagine the innovation. They can think bravely and develop some solutions which they think is best for the veterans, because they are the frontline employees. And so in last 3 to 4 years, I took multiple appointments and including my current position, which is in Memphis, which is an innovation specialist. That's a part of the VHA Innovator Network, another portfolio in the VHA innovation ecosystem. And as a result of which, developed a partnership within the Memphis VA and 15 other VA hospitals. And the movement came in 2019 when Memphis VA became a VHA Innovator Network site. What does that mean is that there are only 33 VA hospitals all across the country who are a part of this innovator site. And what's there for the employees if we became an innovator site? This program provided the platform for the frontline employees, and not only for funding, but for the education, for networking support for their innovation project. And I felt so proud for this accomplishment, what we got it in Memphis VA. And last 2 years, Memphis VA ranked number 2 among all those innovator sites, because we have such a variety of the almost 30 projects with 100 employees who are doing at this time. So the topic which is close to my heart, and I can give you a little bit later that how it started, the transportation. Although I am not from the transportation program office, but that is something which I'm very sure audience might be of interest, that why transportation? We talk about the access of care to veterans. And this is one of the largest barrier transportation for our 5 million veterans who are living in a rural and urban areas. Most of the time, people think it's only a problem in the rural areas. No, it is problem in the urban areas also. And also in 2017, there was a survey which showed that 1.8 million missed appointment, which happens every year in the VHA facilities, is because of the transportation issues. And that cost agency almost $4.4 billion. So is there any way we can do something so that we can decrease this missed appointment and also for our veterans can have a positive healthcare outcome? So that's how this whole stuff came up, that can I focus on the transportation? Coming to the point that how I started my journey in this space, and then coming to this initiative where we are, is in 2019, we launched the Homeless Veteran Employment Initiative at Memphis VA in collaboration with Boston VA. And we got that funding from the Innovator Network as a seed application. And we provided the rights to the homeless veterans for job interviews and improved the veteran access to jobs by 50%. Again, in 2020, I launched another program in our Memphis VA, which were called as a VA Rural Healthcare, and where we provided the non-emergency medical transportation to increase the access to care for the rural veterans after the Mission Act. So after working in this space in last 3-4 years, the challenges which I faced, and that's how I can tell that how this initiative came up, is that can we bring the technology of a ride share? Because that is something which I use very often in my personal life. I don't drive car too much. Wherever I go, I use Uber or Lyft. So that thing came up in the mind that there are so many challenges. Can we have a partnership or a collaboration with the Uber Health or with the Lyft to bring their technology, which is almost impossible to get it in the VA. If we can bring that technology, can we bring the stakeholders like the program office, Veteran Transportation Program Office, network directors, the CEOs to buy in on that? And if we can buy in on that, is it possible that the workforce, which is working in the front line in the hospital, will be able to do that? And if we can do that, is there a way and can we make sure that all these things can be integrated and we can have some platform where the request can be done on the monitor in front of in the office as a centralized dashboard?
You know, I'll say my story and my my current role. I'm as a director of the Veterans Transportation Program. So that's the National Program Office that manages beneficiary travel as well as the Veteran Transportation Service. I'll say the innovation specialist, like Indra's role at Memphis, and the connection to the VHA innovation ecosystem is not as strong within my part of the organization as it is out at the medical centers. We don't have the staff position as innovation specialists and things like that. So this is my first real interaction with the innovation ecosystem, and it's been enlightening for me, to say the least, and refreshing. Where at the at the program office level and working at the facility level, there always seems to be so much red tape, no matter which way you go, in connecting with a group of stakeholders like the innovation ecosystem and Indra, and the folks that we've worked with from that part of the organization has really helped kind of refresh the innovative thought process, challenge me and my folks to, still keeping in mind, as Indra mentioned, that it's not just can we, but how can we, and really taking a step further and not just taking that initial no for an answer, but making sure that we peel back the onion in all the different ways, obviously following all the regulatory and legislative statutes that our authority is tied to, but it's really it is my first interaction there with the innovation ecosystem in the 6 years that I've been with VA, in the 3 years that I've been in the role that I am now. So really excited, to have that connection now between our program office and the innovation ecosystem, and definitely look to continue the relationship beyond this particular initiative. So that's kind of how we've come together, and how I've gotten connected and plugged into the VHA innovation ecosystem.
Definitely. And taking all that into account, what was the original inspiration behind starting the VHA-Uber Health Connect initiative? What was the genesis there?
The challenges were, can we bring something like a rideshare services, which we are using? And as I mentioned earlier, let's go back a little bit. As I mentioned earlier, that the transportation is the largest barrier. Is there anything, can we provide the transportation as easy as raising hand to the veterans? And if we can, what are the options? And the options were something which you use in your daily life, like the rideshare services. And it doesn't have to be Uber, it can be a Lyft, but the rideshare service, can we do that? That was basically a thought initially, that can we bring the rideshare services in the VA? And if we have to do it, I think so we have to make sure that what is available in the VA. And so before reaching to the Uber Health and getting all those stuff, I did reach out to the Veteran Transportation Program Office, talk to them after I got my fellowship to work on this initiative. Again, like Ben mentioned, can we have a partnership? Can we have a collaboration with rideshare services? Because that is the first start. If we are thinking of envisioning something as a rideshare services, can we have that? And for that, we have to make sure the background, what is the background of the transportation, what is the background of the rideshare services in the VA hospital. And if we know that, then we can see what are the challenges for us to have a collaboration with the Uber Health. But I will let Ben to chime in here that what is the history of the rideshare services in our VA hospital?
Yeah, thanks, Indra. So for the last several years, since the rideshares really started picking up steam in the I'll say late 2010s, we have a traditional part of the beneficiary travel program where veterans, we got the affirmation from OGC that, hey, these rideshare services are akin to or likened very similar to and legally can be authorized for us to reimburse veterans through our common carrier reimbursement process. So that's the existing authority that we have to reimburse veterans for trips to and from VA or approved non-VA care using taxis, bus, train. In 2017, we got the affirmation from OGC that that rideshare was part of that group. So the spin and part of the innovation that comes with this process is in taking the responsibility out of the veterans' hands and allowing them, just like the other services that we have, like the Veteran Transportation Service, which is our in-house transportation network of drivers and vehicles that we have out at the medical centers, allowing the veteran to raise their hand and say, hey, I need a ride, and then letting us take it from there, verify their beneficiary travel eligibility, see if we have capacity to service them in-house. And if we can't service them in-house, make sure that they can still get to their appointment by utilizing the rideshare service. And there are some other assumptions in there as part of the process, but we want to make that process very simple. And to be frank, the other main driver was we need capacity. And when I say we need capacity, we can't service all the veterans who need rides with our in-house transportation network. It's just the resources aren't there. So we needed the capacity, and in looking at ways to increase capacity, this opportunity and Indra reaching out from the innovation ecosystem to say, hey, what can we do in this lane, was really a perfect match, because the rideshare services have a ready-made network of drivers. And, if that veteran is beneficiary travel eligible and they're ambulatory, it really leads to a very positive, I'll say, a positive experience for the veteran, as well as increasing capacity for us to ultimately serve our mission, which is get as many veterans to and from their appointments safely as we possibly can.
Absolutely. And to get down to what you're really hoping to address there with your central mission and the foundational purpose of the VHA-Uber Health Connect initiative here, what challenges do veterans, especially transit challenges, do veterans commonly face in being able to access VA health services? What are some of the usual obstacles there that you're helping overcome?
Sure. So, just thinking in terms of its most basic form, the veteran population on average is getting older. Oftentimes, with the aging process, and depending on the type of procedure being done or the type of appointment, being able to transport yourself is not necessarily something that can always happen. Additionally, there's just in society in general, there's more and more people, and proportionally more and more veterans not having access to their own personal vehicle, whether it's a personal choice or just financially not something that's available, or otherwise. So that obviously not having access to transportation, and not having someone there who can take you, or not being able to physically transport yourself, that's obviously the biggest challenge, being able to access the healthcare services. The agency's done a lot of great work on some of the, I'll say, historical challenges in terms of getting veterans enrolled and things like that. So the next step in making sure they can get the care that they've earned, is making sure they have the transportation. So just making sure that we have enough transportation capacity, as I mentioned earlier, to get veterans who do need a ride, is really what the biggest challenge that veterans are facing is A, making sure we have the capacity, and B, creating a process that is easy for them to execute. I mentioned before, the rideshare part the rideshare modality is part of the authorized reimbursement mechanisms, but a lot of veterans, they may not know how to use the rideshare apps to initiate a ride for themselves. And then there's also, a claim reimbursement process that a lot of veterans choose to avoid, and just because they don't want to have to do the application that's required from a statutory perspective, and go through the process to get EFT and all of those other things. So those are the challenges that this particular process and initiative addresses, and things that from our perspective in the program office we were looking to address with the process.
So adding some numbers, Adam, here, what Ben mentioned from the data point of view, to give you a little bit of an idea that of how big is the problem and how big is the challenge which we are addressing. More than half, the 56% of the total population which we have getting the healthcare are 65 years or older. And this is, I'm talking about the 5 million veterans who are facing the transportation issue. 460,000 are post 9/11. 18% have one or more service-related disability. 52% have lower average household income than other veterans. 54% having only one car. 6% not owning a car, who are the people who are living in a rural area also, lacking a valid driver's license, and 13% relying on friends or family for the transportation. So those are the numbers which make sure that these are the numbers which is the biggest barrier and the biggest challenge for the veterans to get the access to care. And if you go in the rural side, that is completely different story. Some numbers there is like a 23% of the rural veterans either canceled or missed appointment, or they never obtained the medical care due to the lack of transportation. So this is what we are dealing here. And as a result of which the missed appointment comes. And when the missed appointment comes, you can imagine it's a chain reaction and leading to the poor health outcome for the veterans. So that's what we are dealing from the challenge point of view.
Definitely. It sounds like you've really managed to provide a degree of access that clearly wouldn't have been there otherwise. And to extrapolate from that a bit, I'm wondering so far, what regions has the VHA-Uber Health Connect pilot been launched in? Where are you currently serving and where have you been able to see, benefits and payoff from this so far?
Yeah, and Adam, and before we'll go in that, let me give a little bit of a snapshot. We did talk about that, what are the challenges, how this initiative started, but what is this initiative? What we do? Is it something we ask the Uber to come and then take the veteran back to front? No, it has a lot of the steps. So to give you and the audience a little bit of what this initiative is. Like Ben mentioned, this is a collaboration between the Veteran Transportation Program Office, VHA Innovation Ecosystem, and Uber Health Rideshare Services. What we did here, we integrated the dream thing, which we wanted to do that. We integrated the HIPAA compliant technology of a Uber Health into the existing transportation system to make the modernization of the transportation system so that there will be a centralized dashboard from where the clinics and the transportation team can schedule the ride for the veterans. So literally the transportation team can sit in their office in front of their monitor. They have a dashboard. From the dashboard, they can schedule the ride. They can manage the ride. They can track the trip. They can record the billing. They can submit the invoice. They can send the reminders to the veterans, and they have 24/7 the support system if something goes wrong. They can see all the track of the driver, where driver is taking veteran and when the veteran is drop off. That's what we did it. We did it one thing for the modernization of the transportation process. Other piece was the easy and reliable and efficient system for the transportation team, because that is also a very important piece. Other piece, which we didn't talk yet, that this initiative at this time is only available for the beneficiary travel eligible veteran. And for the audience, what does that mean? Is that the veteran who has a service connection, they also get their travel reimbursement from the VA. So that funding comes in the VA hospital from the higher up. So we didn't need any funding when we started this because it's a beneficiary travel eligible funding, which already VA hospital has it. So we are using that funding. And for that, what's there for the veteran? It's a convenience. That is what Ben mentioned, is door-to-doctor appointment, the transportation for the veteran. But the other thing is that they don't have to pay upfront, because if they are using their car or if they are using some other taxi, they have to pay upfront and then get the reimbursement. They don't have to pay upfront. They don't have to file the claim, and they don't have to wait for the travel reimbursement. That is another piece which we took really great care of that. We will talk later that what's the response of the veterans, and then also from the provider point of view, what's the main goal of this initiative? Reduce the no-show and the missed appointment. And the cost saving is another piece which we'll talk. But getting back to your question now, that where we did it at this time, we launched after working 1.5 years. We launched almost 1 year with VTP and going through the regulations and the policies and the authorities and the agreement, all that stuff. This January, we launched it into 10 VA hospitals. And those are, let me read it here, because if I will miss any, it is in Vision 9. And for the audience, I'm very sure they don't know which is Vision 9. So Vision 9 is a Mid-South network, which includes Louisville, Kentucky, Lexington, Kentucky, Mountain Home Healthcare System, which is in Tennessee, Tennessee Valley Healthcare, which is in Nashville, Memphis, where I'm located, Vision 15, which is as rural as you can say. It's a Wichita, Kansas, Kansas City, Leavenworth, Columbia, St. Louis, and those are the 10 VA hospitals where we launched it in this January. And we went for a road show to visit all these 10 sites with our integrated team from the VTP, VHA Innovation Ecosystem, and Uber Health to provide the quarterly report to the executive leadership. And there we interviewed a lot of the stakeholders to get their feedback. So we were there from April 26th through May 6th. For 12 days, we were with the whole team going back to back to all these 10 VA hospitals. So that's where we are at this time. It's 6 months into the pilot.
Excellent. Yeah, that sounds like, again, a pretty impressive rollout under such a relatively short time frame. And it sounds like the benefits are clearly manifest already. Jumping off from there, I'm wondering, what feedback have you received from veterans who have used the VHA-Uber Health Connect service so far? And how often are you seeing veterans continually using these opportunities on a regular basis?
That's a very good question. And I will give you some numbers. So in last 6 months, we have till now around 5,800 rides, which were taken by the veterans. And the unique veterans are 2,100. So you can see the number of the veterans are less than the number of the rides. So that means that each veteran took more than one ride. And also from the veteran experience point of view, which let me go a little bit more in detail about the numbers, and then I will let Ben to chime in there. That was a very important piece for this initiative. If I mentioned earlier also, and Ben also mentioned earlier, that veteran experience, you cannot let veteran to sit in the stranger car if veteran is not comfortable. It might be not very big deal for us at this time, but consider about the aging veterans who never sat in the car of a stranger. Now we are asking them that the car is coming, you sit there, how you can make them comfortable. And if we cannot make them comfortable, there's no way we can do anything. This initiative is going to end at that day. So what we did beforehand to make sure that we should get the veteran experience in real time. Another unique partnership and the collaboration we did it here. The VTP VHA Innovation Ecosystem collaborated with the Veteran Experience Office, along with the vet text, to the audience to tell a little bit what this vet text is. It's an app which 3.5 million veterans at this time are enrolled in that app. And that app is like a veteran gets the appointment reminder on their cell phone. And that's why they call it as a vet text. So we collaborated with the Veteran Experience Office, which is known as VEO, and the vet text, so that the veterans can get the text message. This was done first time ever, because generally the veterans get the text message for the appointment. But for here, we requested that, is it possible, rather than waiting for the emails to go to veterans, rather than making sure that the veteran is responding to the text message, they send the text message to the veterans, and as a result of which, we are getting a real-time feedback from the veterans on this. Till now, we have 287 veterans already responded to the survey, which is around 17%. And based on that, 87% veterans strongly agree that they are satisfied with the Uber Health. 89% recommend to the another veteran. 81% think that if they might have not got this Uber Health, they might have missed their appointment. The other piece, what I mentioned earlier about their safety. So 90% felt safe riding with Uber Health, and 87% says that they come on time, and 88% think that the drivers are very professional. And I will let Ben talk a little bit more about their experience of what they told us.
Yeah, thanks, Indra. And as Indra mentioned, just making sure that we were positioned as we go through the pilot to collect that feedback directly from the veterans to help us understand if this is going to be something that veterans really want to use in the future, and it really helps them was critically important. So just a couple of excerpts from some of the feedback that we've gotten from veterans. I love it. I love it. Wherever it came from, I wouldn't change a thing. I think the program runs really well, which is not something you hear traditionally about a lot of administrative programs in the government in general, but especially at the VA. The other one that Indra hit on was I felt comfortable both ways. Even the first one that was at 2 a.m. in the morning. But they knew they wouldn't have a ride home. VA had told me that I was being discharged and they had called an Uber and to get ready to go home. They weren't apprehensive about using the Uber, and it was able to let them go home and sleep in their own bed that night. Those are the use case. There's a multitude of use cases that it's being applied to, and the great part about it is there's flexibility involved in it. It allows the facility and the care coordinators to work with the transportation team to make sure the situation's right for the veteran, and then also be able to quickly, which is the other important part, quickly be able to generate a ride at almost any time of day. So those are just a couple of examples that we've gotten from veterans and on their positive experience with the program so far.
Great. And overlooking all of what you've accomplished so far, I want to get down to the real concrete benefits that the VHA-Uber Health Connect initiative has provided for VA as a whole. And I'm curious, in terms of the return you've seen, how has this initiative helped prevent financial losses due to missed appointments? How has that really paid dividends so far?
Yeah, thank you, Adam. That's a really good good question to give you a little bit of an insight that what we are also talking about, the cost saving, which is also in the VA terms, it calls as a cost avoidance. And also there is a more utilization of this rideshare service for this program. So as I mentioned that since the launch of this program in 10 VA Medical Center this month, and based on our 6-month reporting data tracking, till now we already provided around estimate 6,000 rides to 2,200 eligible veterans, and a cost saving which we are estimating is over $7.3 million, and that is we are calculating based on the ED and the inpatient discharges, as well as from the missed appointment. So when I say ED and the inpatient emergency visits and the inpatient discharges, that is that when we are saving a 1 bed day. And when you save 1 bed day, you are saving basically $4,500. And when you are saving 1 missed appointment, you are saving $950. So that's how we calculated the cost saving or the cost avoidance at this time, which is $7.3 million from January to June 15th. But also to give you a little bit of a idea that how much we spent on the rides to the Uber Health. It cost only $170,000. That means 170,000. Only $170,000 we paid to the Uber Health rides as compared to the estimate of $7.3 million. And I will let Ben to chime in that where we had the maximum utilization of this services and where we had the most saving.
Yeah, thanks, Indra. So, I mean, when you look at the clinic utilization of Uber Health, specialty care, it really makes up the highest utilization of what we have observed so far during the pilot. Followed by dialysis. The specialty care was about 44%, and dialysis is the current rate of that is about 17%. And those two have driven, very significant cost savings from what we've observed, as Indra mentioned. ED and inpatient discharges have a lower volume of rides, but they have a higher rate of cost savings compared to specialty care and dialysis. So we are seeing increases. And again, it depends, as we talked earlier in the conversation, about each medical center and how they're being utilized locally, or how the rideshare service is being utilized locally. But we are seeing facilities that started out using it more in specialty care first, they're also, we're also seeing increases in the utilization for discharges, inpatient discharges, and in ED discharges as well. So we are seeing, consistently the use across, whether it's the different clinics, we're seeing all of those continue to increase, which only benefits the veteran, obviously foremost, because they get to where they need to be quicker, but then also the agency from a cost perspective.
Definitely. And that sounds like it's really been broadly useful and broadly impactful at the locations that it's launched. And going from here, in terms of looking forward and where you see the initiative departing in the future and its progression over, say, the next year or maybe the next few years, what other locations might the VHA-Uber Health Connect program launch? Where do you see the program taking itself from here?
Adam, that's a really good question, and we thought process it really well. That, as I mentioned earlier, that we are currently piloting this program in Mid-South Healthcare Network, which is basically Wichita, Kansas City, Eastern Kansas, St. Louis, and also in Lexington, Louisville, Tennessee Valley, Memphis, and Mountain Home. And we are planning to build on a successful pilot implementation to roll this program as a VA enterprise-wide initiative. And that's a big word, enterprise-wide initiative, which might be over a course of 2 to 3 years. But what's next in the sense after the pilot, because the pilot is going to end in September of this year. We already have in place several visions where we are discussing with them the evaluation of this program, how good fit it might be for their vision, and that we are considering as an enterprise rollout phase 1, where we are trying to implement this Uber Health program in 20 to 25 VA hospital, where we are working with 6 to 7 visions, and as you mentioned that which area it might be. So the vision with whom we are working at this time, it's vision 7, which covers Atlanta, Georgia. Then we have vision 20, which covers most of the Washington, Idaho, and other states on that region. And then we have vision 16, we have vision 17, vision 22, vision 2, which is very new for us, and it might be a very different region in the Northeast. That is the New York and New Jersey, which is the vision 2. So very wide range of the states where we are going. So might be occupying another 15 or 20 states in the next 1 year, and followed by enterprise-wide rollout, which will be the phase 2. That will be a nationwide rollout for the rest of the VA hospitals over a 2 or 3 years.
Again, our goal is to roll out enterprise-wide, and Indra provided a really controlled timeline for us to do that. We are working on a national SOP with the lessons learned from the pilot. In the event that there are medical centers who feel in advance of how we very deliberately roll out I'll say this process or capability across the enterprise to ensure it's done properly, so in the event that there are others that want to roll out ahead of the schedule, that they can do so. It's something that we want to make sure, because of all the regulatory and I'll say statutory requirements that have impacted the way that the process has been designed. It's important that we keep that in front of us and maintain that compliance as we go through that. So I'll say when you look at enterprise rollout, to do it right, even a 2-year timeline is very, very, very aggressive when it involves, so much work at the facility level. So we're excited about where it's going. We've proven through the course of the pilot that whether it's an urban facility or a mixed urban rural or even a more rural facility, there's utilizations for it. So we're excited to get it everywhere we can as quickly as possible, but at the same time do it in a manner that makes sense and can allow us to do it properly.
Yeah, and that's something we are expecting that with the expansion of the program will ensure that our goal remains same, which is the target here, that the patient can get to their appointment reliably on time, that caregivers can focus on providing the best care possible, and also the VA Medical Center can have a cost saving or the cost avoidance so that they can reinvest their resources in their other initiatives and also to increase their impact.
Definitely. And in terms of where you're looking at the support you've received from VA and the people who helped make this program possible, who do you look at as who've been really foundational in helping bring the initiative to life, not just in terms of the work you've both done, but in terms of providing the critical support that's allowed this initiative to be found and expand?
Yeah, Adam, that's a long list. And Ben and me are a very few drops in the sea. Because and only 2 drops, but other than that, it's like a huge list of the sponsors and the team members who literally played such a big role here. And I will touch only maybe a few of them here, their feedback of what they think that what this program is, and also where it might go in future. So some of the, as I mentioned earlier, in our road show, which we did in the last week of April and May, we did interview several of our stakeholders, starting from the executive leadership, medical center directors of the VA hospital, the network directors who runs the vision, and also the frontline employees, because those are the most important piece of this whole initiative. So maybe I will read some of the very quick testimonials of maybe 1 or 2 from the higher leadership. As the network director of Vision 15, Dr. Patterson mentioned that without access, healthcare is meaningless. So to address access, VHA-Uber Health Connect is important for us. And the one word which comes to his mind about this program is innovation. Then we also interviewed another sponsor of this initiative, the network director of Vision 9, which is Mr. Goings. According to him, this initiative is another tool in our toolbox, and the opportunity to use this private-public collaboration is to provide a way to our veteran to their appointments. And also, he did touch a little bit from the healthcare point of view. Yes, it is good for the veterans. What's there for the healthcare system, for the VA hospital? So from the operational point, he did mention that it takes some responsibility of the organization internally, so we can use the resources for other program as it is very efficient internally to the operational impact. And both the leadership and the other sponsor think that the next step in this for this initiative is the expansion of the program, and also the more awareness to our veteran that these resources are available for them. And I will not go in detail about all the other feedback which we got, but that is some things which I also want to read here, which we got it from the frontline employees, especially the mobility manager, the transportation team, who is scheduling the ride and seeing the impact of it. The Tennessee Valley Healthcare System mobility manager, he mentioned, we are thrilled to have found a match for the veteran. If no transportation was available, they would have had to spend an additional day at the facility. The Lexington VA Hospital mobility manager said, requesting the Uber in the dashboard was simple. I was able to cancel the trip and duplicate with the correct pickup time. This was done without any help. The Uber dashboard site is very easy to use. So from their experience and also from the veteran experience, this is what we are hearing from the field. And that's what I thought that it might be good to bring up here. Ben, anything to add?
Yeah, thanks, Indra. I mean, Yeah, I don't think I have a ton to add, just in terms of the feedback that we've gotten. It has come in just that it has come in at all different levels, whether it's leadership level, staff level, and veteran level, as something that's been had a very positive impact. And like any new process, we're working out the kinks, so we've gotten some of that feedback as well. But all in all, very overwhelmingly positive, really. From a thank you perspective. I know, Indra, you've got a long list of folks to thank. I want to thank you, Indra, in the innovation ecosystem for bringing this back up as an opportunity for the agency to use and really devoting and utilizing your time and network and networks and other avenues that we as a program office haven't traditionally used or been aware of in the past that were available to help make this happen. And then obviously the folks on the front line at the staff level, super important to make sure that we give our gratitude towards. There's a lot going on administratively in VA, whether you're talking about staffing shortages or things, other new processes, a whole new EMR at some sites. So there's a lot going on. So to ask these folks to take on something else because it really benefits veterans, and then them doing so willingly involves a huge, tremendous thanks. And so, Indra, I'll let you take it from there. But those, wanted to make sure that we were able to thank you and the innovation ecosystem for the partnership in this. And then I'll let you take it from there.
Okay, thank you, Ben. And I will add, I think so, echo the same thing. It's almost impossible. You and me as a lead and co-lead, but we have a huge army behind us who is supporting us and making our dream coming true. You from a leadership from the Veteran Transportation Program Office, a very visionary leadership, considering that this was never done with the program office, and a new collaboration, having a visionary leader like you who can see far in the future. And also want to express my sincere gratitude. I will take 30 seconds here, but I have to add their name because they do deserve all the things what we are seeing here as an outcome. To all the executive sponsors, the executive director of VHA Innovation Ecosystem, Kate, the network directors, Mr. Goings, Dr. Patterson, member service executive director, a big thanks to him, Mr. Garth Miller, who is the executive director of member services, all our collaborators, the Uber Health leadership, Caitlin, executive director of Veteran Experience Office, John Burstall, Shane and his team from VetEx, and all the executive leadership team and the staff of VA Medical Center in Vision 9 and Vision 15. But I will not stop here. I will take another little bit, few minutes or maybe few seconds to special thank you to our integrated team from VTP, Veteran Transportation Program Office, Rob Arrowwood, Brenda, Richard, Mark, and many more from Uber Health, Steve, Taylor, Corey, Jacob, Elizabeth, Emily from Deloitte, and the transportation team from all the VA hospital, including Scott Holt from Kansas City, Mark from Columbia, Chris from Tennessee Valley, Cami Tate from Lexington, Jennifer from Louisville, Karen Adam from Memphis, Angela from St. Louis, Mary from Eastern Kansas, John and Charles from Wichita, John and Eric from Mountain Home, John Griffins and Genevieve, the business implementation managers from the Vision 9 and Vision 15. And last but not least, my former supervisor and now advisor, who is a big advocate of the innovation. Now he's a medical center director from Tampa, Mr. Dunning. So that was a long list of my thank you. If I miss somebody, I really apologize. But from the bottom of our heart, Ben and me are very obliged that you all are part of this. So thank you, Adam, for having us here, and also to audience for listening to this initiative, which is bringing a tremendous value to our veterans and VA. And the most important is that this program is bringing the ease of access to care for our veterans.
Absolutely. And Ben and Indra, thank you so much for coming onto the program.
Thank you so much, Adam.
Thank you, Adam. Take care.
HealthCast, along with GovCast and CyberCast, is a production of GovCIO Media and Research. For more podcasts and to check out the other shows, head to govciomedia.com. Watch out for new episodes released every Tuesday and Wednesday across our shows. You can follow all of them in your favorite podcast platform, and if you like what you heard, make sure to let us know by leaving a review. And if you have any topics you think we should look into, contact us at newsletter@gcio.com.